As COVID 19 or the coronavirus ravages the world, the moot question that every nation is asking is lockdown the answer? The world opinion right now is divided on the subject. In this episode of The Colonel Speaks, we shall hear some of the global leaders as they chalk out their plans. We will also discuss the various considerations that go into making these decisions. And finally, followed by what's happening in India. If you like this video, please don't forget to like, subscribe and share, as it will egg us on to do even better. Let's hear some of the global leaders taking sides on the great global dilemma.
Has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer. And so tonight, I want to update you on the latest steps we're taking to fight the disease and what you can do to help. And I want to begin by reminding you why the UK has been taking the approach that we have. Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses. And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. To put it simply, if too many people become seriously unwell at one time, the NHS will be unable to handle it, meaning more people are likely to die, not just from coronavirus, but from other illnesses as well. So it's vital to slow the spread of the disease, because that is the way we reduce the number of people needing hospital treatment at any one time, so we can protect the NHS's ability to cope and save more lives. And that's why we've been asking people to stay at home during this pandemic. And though huge numbers are complying, and I thank you all, the time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home. Because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all. These are the only reasons you should leave your home. You should not be meeting friends. If your friends ask you to meet, you should say no. You should not be meeting family members who do not live in your home. You should not be going shopping except for essentials like food and medicine. And you should do this as little as you can. And use food delivery services where you can. If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings. To ensure compliance with the government's instruction to stay at home, we will immediately close all shops selling non-essential goods, including clothing and electronic stores, and other premises, including libraries, playgrounds and outdoor gyms and places of worship. We'll stop all gatherings of more than 2 people in public, excluding people you live with. And we'll stop all social events, including weddings, baptisms and other ceremonies, but excluding funerals. Parks will remain open for exercise, but gatherings will be dispersed. No Prime Minister wants to enact measures like this. I know the damage that this disruption is doing and will do to people's lives, to their businesses and to their jobs. And that's why we've produced a huge and unprecedented programme of support both for workers and for business. And I can assure you that we will keep these restrictions under constant review. We will look again in 3 weeks and relax them if the evidence shows we are able to. But at present, there are just no easy options. The way ahead is hard, and it is still true that many lives will, sadly,
Strumento, vincolo per tutte le persone fisiche in entrata e in uscita dai territori, anche all'interno dei territori. Ci si muoverà quindi solo per comprovate esigenze lavorative, situazioni di necessità, spostamenti per motivi di salute. Poi ancora sono sospese tutte le manifestazioni organizzate, nonché eventi in luogo pubblico, privato, quelle manifestazioni a carattere ludico, culturale, sportivo, religioso, fieristico, ma sono anche sospese tutti gli eventi nei cinema, nei teatri, nei pub, scuole di ballo, sale giochi, sale scommessi, sale bingo, discoteche. Noi quindi non possiamo più permetterci in queste aree aggregazioni di persone. Sono sospese ovviamente le attività didattiche nelle scuole, nelle università, salvo quelle a distanza. Sono sospese anche le cerimonie civili, religiose, ivi comprese anche quelle funebri. Sono consentite le attività di ristorazione e bar, ma dalle 6 alle 18, con obbligo a carico del gestore di predisporre le condizioni per garantire la possibilità del rispetto della distanza di sicurezza interpersonale di almeno 1 metro, con sanzione della sospensione dell'attività in caso di violazione. Stiamo affrontando un'emergenza nazionale, l'abbiamo fatto sin dall'inizio con misure di massima cautela, la stiamo affrontando
to take action for 15 days to help stem the outbreak. So it's a 15-day period. I guess now would say it's a 14-day period. It's 15 days from yesterday, and we're asking everyone to work at home if possible, postpone unnecessary travel, and limit social gatherings to no more than 10 people. By making shared sacrifices and temporary changes, we can protect the health of our people, and we can protect our economy, because I think our economy will come back very rapidly. So it's 15 days from yesterday. We'll see what happens after that. If we do this right, our country and the world, frankly, but our country can be rolling again pretty quickly. We have to fight that invisible enemy that I guess unknown, but we're getting to know it a lot better. Tremendous things are happening. There's great spirit, tremendous spirit. And I can say that for Republicans and Democrats. I can say that with respect to Governor Cuomo, we had a great talk this morning. We're both doing a really good job, and we're coordinating it. And we agree, different states need different things, and we agree on that 100%. But we had a very good talk, and I think we're right down the same track, and it's going to be very successful. New York has a pretty big problem, I guess, would be the #1 hot spot. It's no fault of anybody's. It's just the way it is. But we're working very closely together. We're also getting FEMA very much involved. They've been involved, but now we're getting them to a different level. And we'll have everything ready. We're dealing with the Army Corps of Engineers should that be necessary. We have them working in some cases, on standby in other cases.
Our analysis of the progress of the epidemic informs us that we need to urgently and dramatically escalate our response. The next few days are crucial. Without decisive action, the number of people infected will rapidly increase from a few hundred to tens of thousands, and within a few weeks to hundreds of thousands. This is extremely dangerous for a population like ours, which has a large number of people with suppressed immunity because of HIV and TB, and high levels of poverty and malnutrition. We have learned a great deal from the experience of other countries. Those countries that have acted swiftly and dramatically have been far more effective in controlling the spread of the disease. As a consequence, the National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March. This is a decisive measure to save lives of South Africans from infection and save the lives of hundreds of thousands of our people. While this measure will have a considerable impact on people's livelihoods, on the life of our society and on our economy, the human cost of delaying this action would be far, far greater. The nationwide lockdown will be enacted in terms of the Disaster Management Act and will entail the following. From midnight on Thursday, 26th March, until midnight Thursday, the 16th of April, all South Africans will have to stay at home. The categories of people who will be exempted from this lockdown are the following: health workers in the public and private sectors, emergency personnel, those in security services such as the police, traffic officers, military medical personnel, soldiers, and other persons necessary for our response to the pandemic. It will also include those involved in the production, distribution, and supply of food and basic goods, essential banking services, the maintenance of power, water and telecommunication services, laboratory services, and the provision of medical and hygiene products. A full list of essential personnel will be published in due course. Individuals will not be allowed to leave their homes except under strictly controlled circumstances, such as to seek medical care, buy food, medicine and other supplies, or collect a social grant. Temporary shelters that meet the necessary hygiene standards will be identified for homeless people. Sites are also being identified for quarantine and self-isolation for people who cannot self-isolate at home. All shops and businesses will be closed, except for pharmacies, laboratories, banks, essential financial payment services, including the JSE, supermarkets, petrol stations, and healthcare providers. Companies that are essential to the production and transportation of food, basic goods, and medical supplies will remain open. We will publish a full list of the categories of businesses that should remain open. Companies whose operations require continuous processes such as furnaces, underground mine operations will be required to make arrangements for care and maintenance to avoid damage to their continuous operations. Firms that are able to continue their operations remotely should do so. Provision will be made for essential transport services to continue, including transport for essential staff and for patients who need to be managed elsewhere. The nationwide lockdown is necessary to fundamentally disrupt the chain of transmission across society. I have accordingly directed the South African National Defence Force to be deployed to support the South African Police Service in ensuring that the measures we are announcing are implemented. This nationwide lockdown will be accompanied by a public health management program.
Land, domestic air and domestic sea travel to and from Metro Manila shall be suspended beginning March 15, 2020 and to end on April 14, 2020.
Histórico de atleta. Caso fosse contaminado pelo vírus, não precisaria me preocupar. Nada sentiria ou seria, quando muito, acometido de uma gripezinha ou resfriadinho.
Mas
O que tínhamos que conter naquele momento era o pânico, a histeria e, ao mesmo tempo, traçar a estratégia para salvar vidas e evitar o desemprego em massa. Assim fizemos, quase contra tudo e contra todos. Grande parte dos meios de comunicação foram na contramão. Espalharam exatamente a sensação de pavor. O sustento das famílias deve ser preservado. Devemos, sim, voltar à normalidade. Algumas poucas autoridades, estaduais e municipais, devem abandonar o conceito de terra arrasada, a proibição de transportes, o fechamento de comércio e o confinamento.
मेरे पाकिस्तानियों, आपसे सिर्फ मुखातिब हूँ कि एक बड़ी बहस चली हुई है मुल्क के अंदर कि मुल्क को लॉकडाउन कर देना चाहिए। पहले मैं आपको ये बता दूं कि पूरा लॉकडाउन होता क्या है। पूरा लॉकडाउन का मतलब मुल्क में कर्फ्यू लगाना। कर्फ्यू का मतलब ये कि शहरियों को घरों में बंद करके और पुलिस और फौज के जरिए पहरा देना ताकि लोग घरों से बाहर ना निकलें। अगर पाकिस्तान के वो हालात होते जो इटली के हैं, जो फ्रांस के हैं, जो अमेरिका के हैं, इंग्लैंड के हैं, मैं आज पूरा लॉकडाउन कर देता पाकिस्तान को। लेकिन हमारा मसला क्या है? 25% पाकिस्तानी गुर्बत की लकीर से नीचे हैं, जिसका मतलब वो 2 वक्त की रोटी नहीं खा सकते। आज अगर मैं पूरा लॉकडाउन करता हूं तो इसका मतलब क्या है? इस मेरे मुल्क के रिक्शा चलाने वाले, छाबड़ी वाले, रेड़ी वाले, टैक्सी वाले, छोटे दुकानदार, दिहाड़ी वाले, ये सारे घरों में बंद हो जाएंगे। और इनके पास क्या वसाइल होंगे कि ये 2 हफ्ते तक घरों के अंदर अपने बीवी बच्चों का पेट पाल सकें? हमारे पास इतनी कैपेसिटी है कि हम इन सारों को घरों में खाना पहुंचा सकें? अभी हमारी कैपेसिटी नहीं है। ये चाइना ने किया था, लेकिन चाइना दुनिया का दूसरा अमीर तरीन मुल्क है और उन्होंने जब किया था तो उनके पास एक पूरा एक सिस्टम था और पैसा था और खुराक थी, वो कर सके थे। हमारा इस वक्त वो सूरत हाल नहीं है। मैं अगर पूरा लॉकडाउन करता हूं तो मुझे ये सोचना पड़ेगा कि इन लोगों का क्या बनेगा। ये जो 25% मेरे गरीब लोग हैं, जो मैं कह सकता हूं वो ये कि आपको खुद अपने आप को लॉकडाउन की तरफ ले जाना चाहिए। आपको खुद सेल्फ क्वारंटीन करना चाहिए। सेल्फ क्वारंटीन का क्या मतलब कि अगर आपको कोई फ्लू हो रहा है या जुकाम है या खांसी है, खुद अपने घरों में रहें। इसको सेल्फ क्वारंटीन कहते हैं, बजाय अस्पताल जाने के, क्योंकि 90% आपको
अगर ऐसी लापरवाही जारी रही तो भारत को इसकी बहुत बड़ी कीमत चुकानी पड़ सकती है। और ये कीमत कितनी चुकानी पड़ेगी, इसका अंदाजा लगाना भी मुश्किल है। साथियों, पिछले 2 दिनों से देश के अनेक भागों में लॉकडाउन कर दिया गया है। राज्य सरकार के इन प्रयासों को बहुत गंभीरता से लेना चाहिए। हेल्थ सेक्टर के एक्सपर्ट्स और अन्य देशों के अनुभवों को ध्यान में रखते हुए देश आज एक महत्वपूर्ण निर्णय करने जा रहा है। आज रात 12 बजे से पूरे देश में, ध्यान से सुनिए, पूरे देश में आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है। हिंदुस्तान को बचाने के लिए, हिंदुस्तान के हर नागरिक को बचाने के लिए, आपको बचाने के लिए, आपके परिवार को बचाने के लिए आज रात 12 बजे से घरों से बाहर निकलने पर पूरी तरह पाबंदी लगाई जा रही है। देश के हर राज्य को, हर केंद्र शासित प्रदेश को, हर जिले, हर गांव, हर कस्बे, हर गली मोहल्ले को अब लॉकडाउन किया जा रहा है। ये एक तरह से कर्फ्यू ही है। जनता कर्फ्यू से भी कुछ कदम आगे की बात। जनता कर्फ्यू से जरा ज्यादा सख्त। कोरोना महामारी के खिलाफ निर्णायक लड़ाई के लिए ये कदम अब बहुत आवश्यक है। निश्चित तौर पर इन लॉकडाउन की एक आर्थिक कीमत देश को उठानी पड़ेगी, लेकिन एक एक भारतीय के जीवन को बचाना, आपके जीवन को बचाना, आपके परिवार को बचाना, इस समय मेरी, भारत सरकार की, देश की हर राज्य सरकार की, हर स्थानीय निकाय की सबसे बड़ी प्राथमिकता है। और इसलिए मेरी आपसे प्रार्थना है और मैं हाथ जोड़ के प्रार्थना करता हूं कि आप इस समय देश में जहां भी हैं वहीं रहें। अभी के हालात को देखते हुए देश में ये लॉकडाउन 21 दिन का होगा, 3 सप्ताह का होगा। और जब मैंने पिछली बार आपसे बात की थी तब मैंने आपसे कहा था कि मैं आपसे कुछ सप्ताह मांगने के लिए आया हूं। आने वाले 21 दिन हर नागरिक के लिए, हर परिवार के लिए बहुत ही महत्वपूर्ण है। हेल्थ एक्सपर्ट्स की माने तो कोरोना वायरस की संक्रमण साइकिल तोड़ने के लिए कम से कम 21 दिन का समय बहुत अहम है। अगर ये 21 दिन नहीं संभले तो देश और आपका परिवार 21 साल पीछे चला जाए। अगर ये 21 दिन नहीं संभले तो कई परिवार हमेशा हमेशा के लिए तबाह हो जाए। और मैं ये बात एक प्रधानमंत्री के तौर पर नहीं, आपके परिवार के सदस्य के नाते कह रहा हूं। इसलिए बाहर निकलना क्या होता है ये इन 21 दिनों के लिए भूल जाए। घर में रहे और एक ही काम करे कि अपने घर में ही रहे। साथियों, आज के फैसले ने, देशव्यापी लॉकडाउन ने आपके घर के दरवाजे पर एक लक्ष्मण रेखा खींच दी है। आपको ये याद रखना है कि घर, वी वर केयरफुल टू नॉट अंडरएस्टिमेट द प्रॉब्लम बट also to avoid knee-jerk reactions. We have also increased diagnostic capabilities. Within 2 months, we moved from one major facility for pan-India testing to more than 66 such labs. We also responded to the call of our people abroad. We evacuated nearly 1,400 Indians from different countries. We also similarly helped some of the citizens of our neighboring countries. We have now built a protocol for such evacuations, including carrying out testing by our mobile
dollars to this fund. Other 7 partners, other 7 SAARC countries can also pitch in.
We create a COVID-19 emergency fund. This could be based on voluntary contributions from all of us. India can start with an initial offer of $10 million for this fund. Any of us can use the fund to meet the cost of immediate.
India has emerged as a global leader when it comes to this. It's to take charge of the task force to tackle the coronavirus outbreak. Now, India has accomplished the feat of organization, a video conference between 8 nations in just 48 hours. Prime Minister Modi is the first world leader to have called for a joint action plan between countries to contain the fast-spreading outbreak. All SAARC nations welcomed India's move, saying that they want to work closely with New Delhi to chalk out a strategy to combat the deadly disease. Our praises were not just limited to South Asia. Leaders from other parts of the world also reached out to Prime Minister Modi. Among the first to call was British Prime Minister Boris Johnson, who discussed coordinated international efforts to tackle the outbreak with Modi. Australian Prime Minister Scott Morrison lauded Prime Minister Modi's efforts to organise a G20 link-up. Listen in.
Also aware that Prime Minister Modi is keen to organise a link-up between all the G20 leaders. I think that's a commendable initiative. Australia obviously supports that, and I've communicated that. That's a matter for the Saudi government, who is the president of G20 this year. But the Prime Minister and I agreed last night that an even more urgent meeting that would be needed would be a further meeting of the G20 finance ministers and central bank governors.
Several international organizations are following suit. Now this, as the G7 will also be organizing a video conference on COVID-19 containment measures.
The decision dilemmas haunting the global leaders are: can we afford a lockdown? If yes, when do we lock down? What is the threshold for lockdown? Is it too early or too late? Till when do we lock down? Are we logistically sound? What are the stocking levels? Will we be able to build the required medical infrastructure? And finally, can we afford what happens to the economy? China enforced lockdowns relatively early while they grappled with the virus. It was on January 7th the new strain of coronavirus, COVID-19, was identified. Less than 3 weeks later, Hubei province was under lockdown and the government was busy shutting down neighboring provinces. While many other countries employed a contained strategy to keep the virus at bay, they did not enforce restrictions on travel or socializing. It meant full-scale societal interventions were not put in place for more than a month. Spain and Belgium did not lock down for 43 days after their first case, while the UK, Germany and France did not impose quarantines until the virus had been in those countries for more than 53 days. Italy locked down faster than most in Europe, 39 days after the first case was reported. And while there is hope the pandemic is coming under control in Italy, Spain is following a very different trajectory. Spain's lockdown came 3 days after Italy on March 14th. At the time, the country had only seen 1,100 cases and 148 deaths. The country is now seeing more than 7,000 new cases a day and is continuing to climb. The delay in enforcing the quarantine across the country allowed people to escape from the cities into the rural areas, which has been cited as a major factor. While in many of the cases the lockdown was done as a reactive measure, however, in case of India, it was more of a proactive one to decrease the rate of infection, so that the medical systems is not swamped and we get the time to augment the meager resources. With this, we come to the end of this episode of The Colonel Speaks. Please do endorse your comments as to how you liked our content, and any suggestions from our viewers will be deeply appreciated. Jai Hind.